around in the media.
Yeah, the reason for that is it's not an aggressive cancer. People can have it, people can die with it rather than off it. So, but it's an important thing to bear in mind. It can have impact on lives.
These cancers are very common. I mean, we come across it in our clinical practice as well quite regularly. I mean, what sort of symptoms should people be looking out for to maybe arrange a visit to see their GP or their primary doctor?
Yeah, I mean, GPs have got an amazing sort of system in place to sort of pick up cancers at early stage. So, for example, people with lung cancer, I mean, people who have a cough for 3 weeks constantly without not subsiding, the GPs are supposed to refer them urgently to the hospital for further investigations. And then likewise for breast, women are encouraged to feel their breast on a regular basis. If there is a lump, any lump, then they should seek the doctors. And I mean, for the prostate, I mean, people often when they become old, they develop frequency of their waterworks and some at night, especially at night. And these are the, I think, basic alarm symptoms for these cancers. And probably worth saying about the bowel cancer as well. Any changing the bowel habit. I mean, if someone goes regularly once a day and they start going once in 3 days, or even on the other hand, if they have diarrhea, then again that's an alarm thing. They need to alert the doctor.
We see on television and here on the radio, there's the government talks about screening programs and about certain tests that they can get arranged. Yeah. How useful are they, or are they just something?
Oh, they have had a massive impact on the healthcare, especially the cancer. So we have 3 nationally funded screening programs. One is breast, and recently started bowel cancer and cervical cancer. And breast has decrease the mortality by 1/4 to 1/2, and likewise the other screening programs also going to have a big impact on the health, I think.
So mashallah, it seems as if the NHS is doing quite a lot of work to try and identify these cancers and get patients seen by their GPs at an early stage, so that we can investigate and treat these cancers as soon as possible.
So, okay, last week you warmed up with Dr. Islami with his exercise regime. Now I hope you guys are all ready for part 2 in Keeping Fit.
Welcome back, guys, for week 2 of Keeping Fit with me, Coach Amir and Coach Mohsen. Thank you guys for paying attention to your health. That's what we want. We want healthy bodies, healthy mind, healthy spirits. Today, guys, we're going to be working on our upper body. Now remember, whenever you do these exercises, you make sure you warm up well, like we did in part 1, and you make sure you stretch well, like we did in last week's session. Okay, guys, now we're going to get into our upper body training. Let's get into it. Come on, Coach Mohsen, let's get down flat. Okay, guys, we're going to start with what's called the box press up. This is a beginner's press up, which is going to be your hands spaced out in front of you, 1 shoulder width. You're going to have your knees on the mat and the feet on the mat. We're going to have good position and good form all the time. Remember, we're going to protect ourselves at all times. Most important thing here, guys, you're going to make sure this stomach of yours is tightened in, is kept tight, and you're going to suck it in. We call it, and you might have heard this term from time to time, engaging the core. So we'll be referring to it as keeping your stomach nice and tight and tucked in. Okay, guys, you're gonna flex down, and we'll hold that position. Look at the position, elbows to the side, chest down, knees on the mat still, stomach tucked in and tightened in and sucked in tight, and he's gonna extend away and relax. We're gonna try 5 of these together. Let's go. 1, 2, 3, 4, 5, and relax. Sit back. And now we're gonna do this every time we finish one of these moves, guys. We're gonna try to stretch out on a simple stretch. So we're gonna get the arm to the back, elbow over now. And you're gonna pull it in and stretch the arm, and you're gonna change over and relax. Now we're gonna swiftly move on to our more we refer to as intermediate press up. Same as the box, but this time, guys, your legs are crossed over, knees are on the mat, hands are 1 shoulder width away, and here we're gonna glide down into the press up position, exactly as we did before, and press away. Let's do 5, let's go. 1, keep that stomach tucked in, man. 2, 3, don't forget to breathe now. 4, 1 more. 5, good stuff, and sit back again. And like I said, every time we do one of these moves, we make sure we stretch the arms out. Okay, guys, finally we're gonna go into what's called the more advanced position here, called a plank press up. A lot of you guys would notice it's a traditional press up, but I call it a plank press up because you're like one flat plank, your body's like a plank straight through, your back is straight, head is arched forward, and your stomach again is tucked in. And here, exactly the same position, you're gonna bend your elbows and you're gonna come straight down and you're gonna extend out and lock out. We're gonna do 5 of these, let's go. 1, 2, 3. Don't forget to breathe. 4. One more. 5. Brilliant. Sit in. Excellent. Okay, guys, we've just finished doing some press-ups. We've done the beginners, intermediate, and advanced style press-ups. Every time you do these forms, make sure you do good stretching between sets. You can have as many reps as you want based on what you can and can't do. I just want to spend a little while just talking about some of the errors in the press-up. So if you come back down to box press-up, Mohsen. 2 or 3 spaces that we're worried about. The first thing is you've got to make sure your stomach is tucked in at all times. So just try to suck it in, keep it tight, and try to engage that stomach of yours. That's the first mistake people make, and they arch their back. We don't want to do that. We want to keep it nice and straight, keep your stomach tight. Next mistake is the elbows kink out. This is wrong when you kink it out to the side all the way. It's going to put a lot of stress on your shoulders, and those muscles that isolate the shoulders are going to get into a lot of trouble later on. And the fourth mistake is when you're doing plank, or the plank press up, is people actually put their bums up and then bring their bums down and don't bend the elbows. And this is a big mistake. And relax. So guys, these are the errors that you want to try to stay away from as much as you can when you're working with us, you're training with us. I'll see you guys next week when we work on those triceps and get them bigger and stronger and get them isolated. Assalamu alaikum.
Jazakallah khair, Dr. Islami. Looking forward to next week's session.
Yes, we're talking about cancer today, folks, and we have Dr. Mirza today. He's our guest for today. Prior to the clip, we spoke a bit about the sort of signs and symptoms that one should look out for if they think they may have cancer. So, Dr. Mirza, can we just quickly recap some of those symptoms and what people should do if they suspect they have?
I think it's vitally important to keep going on again and again on this. We can talk about statistics, what government is doing, but from the people's point of view, from the viewers' point of view, what they need to know, I think, is when should they get concerned, when should they contact doctor. I think we should stress on that. So, for the lung cancer, if somebody is coughing up blood and having a cough which doesn't subside, then they need to go to the GP. And from the counterpart for women, if they have any lump, as we said, they need to alert the doctor. A lot of times, breast lumps may be benign. Okay, majority of breast lumps will be benign, but still worth getting checked out. It doesn't harm. And again, change in bowel habit, as I said, any sort of change from constipation or diarrhea, then they need to alert. And then the GP will take on from there and refer to these necessary specialties.
Okay.
Yes.
So there's still plenty more to come on the next half of the show, so stay glued to your chairs and we'll see you after the break. Welcome back to part 2 of the Health Show, where we're focusing on cancer this week. So this show is live, so do call in and we'll be taking your questions. We have an expert panel today to answer any questions regarding to cancers and your experiences or about any things that you're concerned about with regards to this topic.
Yes, please do call us. We were joined by Dr. Mirza in the first half of the show, and in this second half you are also quite fortunately privileged to have Mr. Mike Thompson, who's a consultant in colorectal surgery working down south. Now, gentlemen, we spoke a little bit about modifiable risk factors in the first half of the show, so just looking at the causes of cancer. Now, Mr. Thompson, what's your opinion on things such as exercise or diet?
Yes, I think there's good evidence that on a population basis, if you have a high roughage diet and do exercise, then you will reduce your risk of having bowel cancer. And that's important on a population basis. To an individual, the effect is much less. For example, you've got a 5% lifetime risk of getting bowel cancer. For people who eat a high roughage diet, you might reduce that to 4.9%.
Okay.
The major factor is, I'm afraid, getting older.
Right, okay, and I guess there's not much we can do about that.
No.
Unless there's a miracle cure.
Exactly.
Mr. Thompson, with regards to, in your clinical experience and from current evidence and literature, patients who have colorectal cancers, if they're picked up early on in their disease process, what are the likely benefits or prognostic factors? How are they likely to do in the long term?
I mean, the great hope with bowel cancer is that if you have an early stage tumour, we can cure the patient. And in fact, overall, now in the UK, we cure 50% of patients with bowel cancer.
Wow.
The problem is trying to catch it at an early stage. And the best way of doing that is through screening, probably not through early diagnosis after the onset of symptoms. That is important, but the most important thing is screening.
In terms of the features of bowel cancer, which ones do you think are the most pertinent, the most symptoms, say change in bowel habit, or which ones are the sort of key symptoms from your experience?
This is important because in terms of public awareness campaigns and for GPs, but basically most people with bowel cancer have rectal bleeding or blood in the poo and a change in bowel habit to increased frequency and looseness of the stool that's persistent. And you have to have all those key things in it to make it higher risk. Lots of people have those symptoms who don't have bowel cancer. Usually they're transient, they only last for a few weeks and then they go away. And the danger in public awareness campaigns is actually making an awful lot of people unnecessarily worried. So almost you could say the most important thing is persistency of symptoms. Lots of people have transient symptoms, but if they persist for more than 4 or 5 weeks, then you really need to go and see your GP. Obviously, if the patient is ill, they should see the GP straight away. But this is in people who have symptoms who don't feel unwell. And that's the trouble with bowel cancer. A lot of people do have those fairly mild symptoms without feeling ill, and they don't see their GP. And then they get delayed.
And I guess, like you said, it's for predominantly the older generation. So someone who's, let's say, 20 years of age shouldn't get too worried just because they're seeing some blood in the poo.
I'm afraid so, yeah. Well, not afraid so. I mean, that is a fact that something like almost over 9 out of 10 people with bowel cancer are over the age of 60.
Age of 60.
I think it's 85%, if you like, are over 60. Only 15%. So it means that the risk in somebody who's in their 40s, certainly, and 30s is tiny. The problem is you do get the occasional patient, and that colours things, and it gets into the newspapers if it's missed.
Yes.
But in fact, it's really quite rare.
So you mentioned screening earlier today.
Yes. I think the idea really is to catch the cancer before it's developed symptoms. Unfortunately, for a lot of people, once you develop symptoms, the die is cast. And if you've got a curable cancer, it doesn't matter whether you go straight to your GP or in even 6 months, dare I say.
Yes.
I wouldn't advise anybody to do that. But, or if you go quickly, because the cancer's probably been there for up to 2 years before it develops a symptom. So if it's going to spread and be incurable, it will have done so, I'm afraid, before a lot of people develop symptoms. That's not to say we shouldn't try and diagnose it earlier once you have symptoms. And nobody with cancer likes to think that they've been sitting around with the cancer for 6 months with their symptoms. So in terms of the quality of care, I think we should make every endeavour to diagnose people quickly once they've got symptoms.
Very briefly, what does actual bowel cancer screening involve and who's that available to?
There are 2 ways of doing it. One is looking for invisible blood in the poo, which I've done recently, because you do it in people over the age of 55. And I found it quite distasteful. And I spent all my life looking after people and getting involved with the poo. I still don't like it. And that's part of the problem. People feel inhibited. But it picks up about 50% of bowel cancers early. And those patients have much better survival. So it's well worth doing. It's very simple. It's very cheap, it's very safe. The other new way, which I think is going to be equally good, if not better, is a single examination which takes 4 minutes with a short colonoscope. It's called a flexible sigmoidoscope. And that can pick up polyps before you get a cancer. There's very few screening programs that actually pick up something which prevents the cancer. It's not with breast cancer, I'm afraid, you pick up early cancers. With bowel cancer, we have the opportunity of preventing it, which is a very exciting possibility.
Yes, and I think we mentioned earlier with Dr. Mirza about chest x-rays for breast cancer and scans for lung cancer, didn't we?
Yeah. For breast cancer is mammography.
Yes.
And again, we have a screening program for mammography between ages 50 and 70. And
that's offered to all women.
It's offered to all women.
Yes.
You get an invite in the post every 3 years for all women in that age. And if you have a high risk in the family, then they start screening at an early age.
At an earlier age. Okay, wow.
Just a reminder to all our viewers that this is a live show, so do call in with any questions that you have related to cancer, whether you have had treatment for cancer or just are curious about questions about symptoms or signs. We have a caller actually on the line, Brother Abdulaziz. Assalamu alaikum.
Wa alaikum assalam, brother.
Assalamu alaikum, Brother Abdul. How can we help you today? What question do you have for the panel?
The question I've got for the doctor is, would he agree with me that the diagnostic system in this country is pretty weak? The doctor doesn't have time. Immigrants who come from abroad, they cannot explain themselves properly. And I'll give you a recent example of my friend's brother who had cancer for a year, and he was prescribed antidepressant for a year. And after a year, when his family got fed up, they sent him to India. And the third day he was diagnosed with a scan straight away. And on the fifth day he was operated and the cancer taken out, and it was a brain tumor. So, you know, it is pretty
Jazakallah khair,
difficult.
Mr. Brother Abdul Aziz. We'll put our question. I mean, we can't answer about specific cases, but
We are sorry to hear of your case. We are sorry to hear that things dragged on this long and your brother had to go to India before he was operated on.
Don't pick it up. The symptoms are pretty clear, you know, but if the family doesn't know, and the doctors just keep prescribing paracetamol, you know. So I think the system is pretty weak on that side. Prevention is better than cure, really.
Thank you, Brother Abdul Aziz, for your call. Sorry,
should-
Dr. Mirza, I think the GPs and diagnosis of cancer.
Yeah, I think that's actually a common problem. A lot of patients who we see in the clinic have that problem. They almost always have some story. I went to the GP, nothing happened, and this came out to be cancer. I mean, that's a common scenario. The problem with that is, like Professor Thompson was saying earlier on, it's like finding a needle in a hay, you know,
Haystack.
and you don't know it's haystack. So it's an uncommon thing, first of all, the cancer. And the symptoms can be similar in other benign conditions as well as cancer. So it's not fair to instigate fear in patients. Every time you have a headache, you can't send for patient for a scan thinking about a brain tumor. Brain tumor is very rare.